Good evening, everyone. Today are all here to celebrate National Doctors Day. Today, that is the 1st of July, in the memory of Dr. Bidan Chandra Roy, who was a physician and the second Chief Minister of West Bengal. So, how do you think the role of doctors has evolved over the years, especially after this COVID has hit?
We can provide online consultations. We can put on the various top doctors. It has COVID-19 has actually emphasized on public health as well as on prevention of various infectious diseases, and there is increased involvement in public health initiatives such as vaccination campaign. You remember this COVID vaccination campaign, and then educating public about hygienic priorities. We used to tell them how to wash their hands, how to wash the vegetables, how to remove your clothes before stepping into the house. So various hygienic measures which we used to take, and this was promoted and implemented. And also obviously about the infection control measures, and everything got attention. So with the advancement of so much in technology and in artificial intelligence also, it has made doctors to make more informed and personalized treatment decisions. And I also want to highlight on one more very important aspect which pandemic has taught us, that it has brought attention to mental health and well-being of doctors. And now we are trying to recognize the importance of self-care and need of support system whenever there are burnt out issues. Now we could realize that we were working so for long hours without recognizing our me time. And so we are now promoting our own overall well-being also, and by making a balance between our professional and personal lives. Thank you.
That is so rightly pointed out, Dr. Rajinder. That is so true, because COVID did teach us, about self-care. It did teach us how we can prioritize our own mental health. We as doctors also need to do that, and COVID taught us that lesson. So, how do you think doctors can prioritize self-care, Dr. Jayashree?
Thanks, Ishita. Well, self-care, as Dr. Rajinder was saying, it was at the time of our this pandemic that we realized what is life and how we should look into that. Can you hear me?
Yes.
So, and that is how we really woke up. And now we have learned that there is truly something known as a work-life balance. That's so important. And COVID really taught us. And if we balance our lives, yes, being doctors, we have to spend long hours in the hospital with the patients. We have to be sincere. That is our main role in the hospital. But once we go home, we must realize we have our home front. And at that time, of course, we can never forget our patients. So at home, we need to prioritize. Once we reach home, we should be with the family. Of course, we are not completely cut off from the hospital, but this valuable time has to be spent with the family, where we really is the time where we are stress-free and relaxed. So I think that is how we can have a work-life balance and enjoy both parts of our lives.
So wonderfully good, ma'am. But having said that, physician burnout is a very real thing. Dr. Vinod,
Yes.
would you want to add on how we should work on our own self-care?
It's a good question. Actually, taking care of self is very important, and it also depends on one's own personality as well. Like working in cancer center, we are seeing so much of suffering. For any doctor, the patient comes to you and he is in some kind of suffering, whether physical, mental, or other psychological suffering. So at times we associate ourselves, keeping ourselves in their shoes. At times the thinking pattern changes to that, how they feel. So being empathetic will be definitely helpful, but at times taking that takes a toll on our physical or mental health also. So maybe doing some kind of meditation or stress booster, that is doing meditation in the morning or whenever we get a time, having a fixed routine for everything, like when I should be having family time or me time, or when should be the patient's time. Like there should be compartmentalization. What do you say? Like if in few days back we heard about the Titan Pandubi, which got that tragedy. So it is related to that only. I have read in one of the book. There are compartments in the Pandubi. Means if one compartment is leaking, so you need to shut that compartment so that other compartment will not be flooded. So similarly, in that way, that sense, if we are at hospital, we are in that compartment. If we are at home, we are in different compartment. So there should not be mixing of the two. Although when we are on call, we are at times, especially on cold days, we are stressful. We are under stress, a bit of stress because we are at hospital. At home, still we are thinking about patients. So I mean, we can't be completely detached from this also. I do feel that doing meditation or developing some good habit, whether it is drawing, singing, listening to music, or taking even a walk, that is good thing. And I have seen during this pandemic is that our screen time has increased tremendously. So if we see, most of the phones will give you the screen time. So if we can reduce the screen time, that will definitely help us in connecting with the people. Instead of using social media, we can have gathering with the real people, not the virtual people. Although technology has its own benefit, it will definitely help, as Dr. Rajinder has told, that it will be beneficial for people who are stuck in remote areas. We can give consultation to them, we can advise them regarding the medication or the procedure. We can teach them also. There are groups, there are on Zoom meeting or Google meeting, we regularly conduct classes. So for person who is in Kerala or who is in Assam, they won't be able to come to Delhi. We can teach them from here also. So that is one. This is one thing that COVID-19 pandemic has emphasized or reinforced the use of technology in healthcare. And taking self-care is, I would again reiterate, maybe we should develop some habit, whether it is reading, writing, or enjoying music, maybe at times having family time, or that way we can have a balance in our life and not to be burned out from medical field.
So wonderfully put, Dr. Vinod.
Yeah.
Absolutely correct. Just like, this is such an important thing. Just like it is important to have phones for telemedicine, in a very, very similar fashion, it is very, very important for us to cut down our screen time. Also, phones hamper our communication, I think. When a person is so much indulged in social media, interpersonal communication becomes less, and a doctor-patient relationship somewhere is based on communication. So, Dr. Jayashree, how do you establish, and maintain that trust and communication, good communication with your patients? Do you have any tips and tricks for all of us? Ma'am, you're muted, ma'am. Dr. Jayashree, you are on mute.
Yeah. Right. That's a very important question, Ishita. A very important point, that communication with the patients, rapport with the patients is so, so important. You have to be honest with them. And if right from the beginning, you are honest and tell them the truth, they will confide in you, they'll have faith in you, and they'll trust you. Like we anesthesiologists or pain physicians, we have patients who, never get cured. You have patients who are high-risk patients undergoing surgery, have problems post-op. But if you talk to their relatives and tell them from the beginning, this has happened and this can happen, and this is now our plan, and meet them at least twice a day, counsel them, I tell you, they believe you, and we never have any problems. So also in our pain therapy, the patients never really get 100% cured at the same time. So don't give them that 100% guarantee, but tell them we are trying our best and talk to them patiently. Another thing is patience. You have to be humble and patient with them. So that, makes, the communication and the rapport with your patient really remains, and you have no problems at all. This is my personal experience.
Thank you so much, ma'am, for sharing that. Dr. Rajinder, do you want to add something to that?
Yeah, I agree with Dr. Jayashree, very well put. And the active listening, actually, active listening, concerns, fears, or questions, it really matters. And then it provides them, and providing them with undivided attention. Suppose phone, don't attend the phone, don't attend anybody who's walking into the room, giving them undivided attention, maintaining eye-to-eye contact, and let them talk without interruption. It will build more and more trust. They will confide in you. They will tell you the whole real story. And I also feel that showing empathy, compassion is always the first. It is the biggest boon in our hand, which we can make use of. And helping create a safe environment. I'm a breast cancer surgeon. So women come and they want complete privacy. They want safe and secure environment. They want support, and they want more love and affection, so that I should be telling them everything in a more empathetic way and understand them. And I always try to use a clear and transparent language, so that while discussing this medical information, I'm not using big words. I am using telling them the information in their own language. If the lady is from whatever background, gaon se hai, sheher se hai, corporate society se hai, so in whatever language she wants to understand, I try to come to that mood. And obviously treating them with respect, dignity, listening to their problems, this is all really helps in establishing a trustworthy environment with them.
So true. Active listening and empathy, and like Dr. Jayashree told, patience and humility. These are so important when we are talking to our patients, and especially the kind of field that we are in, managing pain and palliative care patients. You're managing cancer patients. Dr. Vinod has been doing a phenomenal job in managing palliative patients. So all such patients, we require that empathetic approach towards them. But what do you think comes to anyone's mind when they hear the word doctor? Because in my head, I think it's a serious, wo chashma pehen ke or बहुत serious looking, not directly at you, Dr. Rajinder, but this is the exact picture that comes to your mind,
Yeah.
So do you think, is that image true? Are doctors only serious?
No, not at all. Not at all. We as doctors, like anyone else, we also have different personalities. We also have different passions. We also have our own hobbies. We also live outside of our professional lives. We live with our children. We are different. I'm a mother. I'm a daughter. I'm a sister. I'm a friend. I'm a doctor also. So I have multiple roles to play. I am playing a role of a doctor in a hospital. But when I go out on vacation with children, I am completely a child. So we have different roles to play, and we have families also. And we engage in all social activities, and we try to maintain this work-life balance. And it's worth noting that we take care of the illnesses and deal with patient care, but above all, we deal with preventive medicine, right? We deal with health promotion. We deal with overall health and fitness and well-being of an individual. So that is on a day-to-day basis. Anywhere we go, any party, any social activity, we are asked, अरे डॉक्टर आज मेरे को पेट में दर्द है, आज गैस का दर्द है, चाहे मैं ऑन्को सर्जन हूँ, वो उस वे में नहीं पूछेंगे. So we are doing preventive health care all the time outside our profession. So, but along that, we are a social human being too. We are social animals.
So true. Dr. Vinod,
Yeah.
I can understand that we are not able to, for some reason, turn on your video. I'm really sorry for that.
Yeah. No problem.
Yeah, but can you tell us how, should doctors have fun?
Why not? Of course, we are also human being. Why can't we have the fun? When the general public have the fun. Like if we say to become a doctor, almost it takes at least 15 years of our most productive young life.
Yeah.
Like you need 6 years in MBS, another 3 years for MD or MS, and then another 3 years maybe for further training. So almost 12 years of our life is spent on video is on now. So almost 12 to 15 years of our life is being spent on studying so much to be able to realize the pain and suffering of the patients and how to treat them accurately. Although doctors can still make mistakes, but most of the time we do feel that we would be able to diagnose properly and treat or relieve the suffering of the patient through one way or other way. And we can achieving so much, and it is most gratifying thing. And second is that why not we can't have fun when we are away from the patient. Like if I'm having vacation, we used to go outside. Why not? And once we are away from the hospital, then we can have all the things which we desired. Although it is very difficult to have so much of break or so much of sabbatical which is required. That is also one of the things which will help in preventing burnout of the physician. Taking frequent breaks as and when required, considering how much stressful how much you are working in the stressful environment.
Very true. Very true. So equal parts work and little parts fun, because we don't have much more time than that.
Yep.
What are the joys of this profession, Dr. Jayashree?
Well, Ishita, the joys are whenever you meet a patient post-operatively, as our oncosurgeon will vouch for it. When the patients say you see their smile and a thank you, it is so gratifying. So for the surgeon, for the anesthesiologist, for all of us, in fact, whatever profession we are in. So when you see the patients satisfied, that is the most gratifying thing. And by chance you've had some kind of a complication, which is inevitable in everybody's profession at any time, and the patient recovers, that is one moment where you feel you've really done your best and your God has really gifted you and rewarded you. So I think that's the most important thing. And of course, once we specialize into palliative care, again, the gratifying or the feeling of comfort, not only for the patient, but by the relatives, is so satisfying, and you feel so you feel so rewarded and so happy that you have been able to do something for the patients. So I think that is the most important thing for the patients, for the families, that we care and they are truly happy and they think that we have done what we were expected to do. I think that helps a lot.
That is so beautifully told, ma'am. Dr. Rajinder, what do you think are the key qualities, and the joys of being a doctor?
Yeah, I agree with Dr. Jayashree. And for me, one of the most biggest rewarding aspect is the ability to make a difference in people's lives, especially young women who come, treating them and making complete so that they don't feel the organ loss psychosis, making them happy, listening to their concerns and fears, This is the most intensely gratifying thing to me. And apart from this, we develop long-term relationship with the patients and their families, and they also become very deeply meaningful relationships, and they become our families only, because I run support groups, and in that support groups I call all patients, also their husbands or their families also, and they really take part in all the activities of these support group meetings. And apart from this, I think being a doctor, what gives me more joy, it helps me grow personally. This is my personal growth, and it is my self-improvement. It is a continuous learning process. Each day I'm learning. Each day medical science is advancing. Each day we have different new surgical practice, new chemotherapy drugs, new radiation, new mechanism. And it's a constant learning and innovation as a doctor for me. And I take this opportunity to stay at front, so that I am learning all the leading medical advancements every day. So that way, I found that being a doctor, I feel very, very happy and proud, and I think it gives me numerous joys and rewards in my life.
That is so nice, ma'am. Because I absolutely agree. You know, that personal growth, when you see yourself, it is like what we were yesterday, we are not there today. We are a step ahead, and we keep going forward, you know, and it just is so important also to be a doctor. Dr. Vinod, what do you think attributes to be a good doctor?
Attributes, I would say, having a good communication skill. I would say the number one attribute to be a good doctor is to have good communication skill. The patient may comes hearing your name because you are so famous, but if you don't know how to talk to the patient and the attendant, and thinking about going into the patient's shoes, what the patient is feeling, that will make the patient at ease most of the time. So having good communication skill, as well as another thing is that the doctor should be having should be up to date with the latest knowledge, latest recent advances, whatever there, because you can't be practicing what is being taught to us like 15 years ago or like 5 years ago. There is changes in the medical field every day. Studies which are being published every day. So many results. We have to keep ourselves updating, because one thing which is being practiced in the past is not effective anymore. There are better techniques, or the thing which is useful previously is giving so much of side effects, or so is there are so many complications associated with that. So we need to keep ourselves updated. So that is second thing. First is communication. Second is to keep ourselves updated with the latest academic advances. And third, I would say being grounded, that having a normal work-life balance and feeling of gratitude that the God has given us this ability to make a difference in patient's life by whatever way. So that will be, we need to be grounded that yes, God has given us, although we have done our effort, we have studied so much, but still it's not that everybody who wants to pursue to become a doctor becomes a doctor ultimately. There are so many people who studied or who wants to be a doctor, but almost 80% are not able to become a doctor. They change midway or they drop their plans. So being thankful to the God and being thankful to the patient that they are allowing us to treat them, because initially any physician, they commit so many mistakes. And we should be thankful to the patient that they allow us to fine tune our skills, our knowledge and our practice. So these are the three attributes which makes us a good doctor.
So nicely put, Dr. Vinod. Absolutely, you know, in this competitive world, not everyone gets a chance to do what we are doing. And somewhere it's in the God's plans that we have to help that patient, you know, And I think that somewhere in those plans, that patient also helps us. Each patient helps us in one way or the other, whether it's our professional growth, or it is our, or our own personality. I think our own personality grows because of, our interaction with the patients. And Dr. Jeshi, you want to add something to this?
Well, I'm listening to all of you, and I, of course, fully agree with what Dr. Vinod was saying. That's very, very true. And on top of that, we have to be very humble. We have to remember that being humble and, as he said, grounded, and we have to be very humble and patient. Patients sometimes get impatient, but we cannot lose our cool. So all that adds on to our personality. The more senior we go and the more practice that we have to remember that humane, being humble, because the patient has come to you with so much expectations, and you have to give that enough time, because nowadays the main complaint of the patients is that the doctor doesn't listen to us. He just starts, and you know how it is now. The stethoscope has also gone, and with the symptoms, you just sometimes, being super specialist, you just write down the investigations. But no, that touch with the patient, the communication, being humble, giving the patient time is very, very essential.
Very, very true. And just like Dr. Rajinder also added to that, listening with empathy.
Yes, absolutely.
Dr. Rajinder, would you want to emphasize on that again? We would love to hear your words.
Everyone has put it forward across in a very, very beautiful manner. And I would only add to this by saying that ethical practice and professionalism also plays a big role. Patient comes to us with full trust, with full faith. They consider you God, ki aap jo kar de, wo kar de. And we should be able to give them the complete updated, the new thing, what is in our guidelines, and we should maintain their trust. And maintaining confidentiality is also very, very important. And we work as a team, we collaborate, we learn from each other, our colleagues and everything, and that goes hands in hand.
Oh, very true. This has been such a nice, discussion, such a nice webinar. Does not feel like a webinar. It just feels like all three of you, friends from different parts of Delhi, coming and talking to us about why you love being a doctor. And this humility that all of you have, this patience that all of you have, and this love for the patients that all of you have really, really, really touches all of us. Thank you so much. On that note, happy Doctor's Day to all of you.
Thank you.
It was fun interacting with everyone. Thank you.
Thank you so much. And thank you, Dr. Rajinder and Dr. It was so nice interacting with you all.
Thank
you, Dr. Rajinder.
Thank you.
Thank you. Happy Doctor's Day. Bye-bye.
Happy Doctor's Day.